This week on Real Talk with Denver7 and CPR News, curbing prescription drug costs in Colorado.
High drug prices impact every single healthcare consumer.
As people across the state struggle to afford much-needed medications, a new experimental board is hoping to help.
Prescription drug prices are, they are out of hand.
A look at the work being done to save patients money and why some people are concerned cutting costs could also cost them access.
Just hearing that they wanted to even risk our lives to do this was like, I couldn't hear.
Welcome to Real Talk with Denver7 and CPR News. I'm Denver7's Micah Smith.
And I'm Colorado Public Radio's Nathan Heffel. Each week in a partnership between Denver7 and CPR, we have a real talk about issues impacting underrepresented people across Colorado.
Anyone who needs prescription drugs knows the cost can be outrageously expensive. In fact, the Alterum Institute says prescription drug costs are the fastest growing consumer medical expense in the U.S.
Research from the Colorado Health Institute says almost half of all Coloradans take at least one prescription medication. In 2021, nearly 10% of Coloradans were unable to fill a prescription due to the cost. Of those, 40% said their health condition worsened as a result.
So now Colorado is working to be the first state in the country to cap those costs. The state established the Prescription Drug Affordability Review Board, which could set maximum payments for unaffordable medicine.
Groups like the Colorado Consumer Initiative have been lobbying for legislation to cap drug costs in the state. Here to tell us more about that is Priya Talang from the Colorado Consumer Health Initiative. Thanks so much for being here.
Thanks for having me.
So why is it important for the Colorado Consumer Health Initiative to advocate for affordable prescription drugs?
Well, the Colorado Consumer Health Initiative has been responsible for advocating for more equitable healthcare costs, more affordable healthcare costs, and more access in the state of Colorado for over 20 years now. And so we've been hearing from consumers for the last 2 decades that their prescription drug costs are unaffordable. And so we know that affordability is the main barrier to accessing prescription drugs, and people can't really afford their drugs, and so they won't be taking them.
Yeah, that makes sense. Your organization has expressed a lot of support for the Prescription Drug Affordability Board, which aims to lower those costs. Can you talk a little bit about that support and what exactly the board does?
Right. So the board is one of the only mechanisms in the state of Colorado that really looks at the root cause of high drugs. And then if those drugs are deemed unaffordable, then they have a responsibility to limit the cost of those drugs in the state. And so they do that through different mechanisms. The board's responsibility is to review thoroughly those drugs. And so they do that through data from the state. They do that from input through manufacturers. And then they do that through stakeholding with patient groups and their caregivers as well.
So there are some concerns that if the board caps those costs, drug makers will pull out of Colorado pharmacies. Is that a concern, and what are your thoughts on that?
Unfortunately, pharmaceutical manufacturers have a vested interest in threatening and scaring their patient groups. Oh. It's a tactic used by them to distract from their price setting practices, and also to ensure that their profits are protected. Drug manufacturers have expressed that they have a responsibility to patients, a responsibility to improve patient lives, and so we, as a consumer group, really expect them to uphold their own values that they've expressed in this case.
It seems the fact that because there is that vested interest, that there needs to be consumer groups like yours who can step up for the consumer to say, that's not great. Is that one of your personal reasons for getting involved in this organization, to say we have to have these consumer groups who can help advocate for the every person, if that makes sense?
Yeah. I think healthcare is so confusing, and it's built that way on purpose so that folks, have a difficult time and can't really advocate for themselves, which is why we developed a consumer assistance program in 2018. It's so that patients can really advocate for themselves against hospital systems and their insurers and make sure that they're getting a fair price. And so our group was founded because there was a lack of consumer input in terms of legislation that's happening and these systems that are built to ensure profits for these larger corporations that are hospital systems that are huge conglomerates, and these insurers that are huge also, and they make billions in profits every single year. So.
Yeah, you mentioned the consumer assistance program. I think that's what you said. What other programs are in place? Or you can go in more in depth in the program you mentioned, but I know that there are other options out there to try to make prescription drugs more affordable.
Yeah, Colorado is actually in the forefront of some of the prescription drug legislation. As we mentioned, the Prescription Drug Affordability Board is one of those landmark legislations. But recently, the Colorado legislature passed out-of-pocket caps for both EpiPens and insulin. The legislature also passed in 2019 a drug import program from Canada, and so that's getting up and running now and should be approved hopefully by next year. And so these are programs that are at the larger scale trying to impact consumers' out-of-pocket costs.
Yeah, and a lot of the focus on prescription drug costs has been on patients with chronic illnesses that use these lifelong medications. How do high drug prices impact you if you don't have a chronic illness? Does that make sense?
Yeah. Well, I'll get at the first point first. Chronic illnesses, people with chronic illnesses are often impacted the most by high drug prices, which is why they're often at the forefront of those conversations. High drug prices impact every single healthcare consumer across the board, though. Prescription drug prices have a significant impact on our premiums, and so as we continue to see healthcare costs like prescription drug costs rise, we're going to continue to see our overall healthcare costs rise as well.
Yeah.
So it impacts everybody.
Every single consumer.
Yeah. Because I just know that I take medication, and 1 month is this, the next month is a little higher, then I work with my pharmacist, and they're like, well, we can get you on this thing to save you a little bit, but it's so piecemeal that I never really know how much my prescription drugs are going to cost. Do you have any advice or talk to people, because you're part of that consumer advocacy group saying, hey, this isn't great?
Yeah. Well, you can always reach out to our consumer assistance program. The unfortunate thing is that there's so many different rebates and discount programs that are across the board difficult to access in general, and so sometimes you don't even know that you have a discount on your drug until you're already paying for it, and you check whatever app or whatever program or whatever manufacturer happens to give a discount when they should just be providing the drug at a lower cost in general. So
that is great advice there. Priya Talang with the Colorado Consumer Health Initiative. Thank you so much for joining us for this Real Talk.
Thank you for having me.
All right, well, much more to come on this Real Talk. We're just getting started here on prescription drug costs in Colorado.
Coming up, why some patients fear cutting costs could cost them access to these much needed medicines.
This is Real Talk with Denver7 and CPR News.
Welcome back to Real Talk with Denver7 and CPR News. I'm Colorado Public Radio's Nathan Heffel.
And I'm Denver7's Micah Smith. We're talking about Colorado's first in the nation plans to lower prescription drug costs.
Well, cheaper prescriptions sounds great. Some patients are concerned lowering costs could lead to drug makers pulling out of the state. This session, lawmakers considered a bill that some say would have helped protect access.
The measure, if passed, would have stopped the Prescription Drug Affordability Board from setting price caps for so-called orphan drugs used to treat rare diseases. But now, that measure has been laid off indefinitely. So joining us now is Amanda Boon, a patient who relies on one of those drugs. Amanda, thank you so much for being with us today.
Yes, thank you so much for having me. I appreciate it.
Amanda, you have cystic fibrosis. For our viewers who aren't familiar with this disorder, can you explain what that is?
Yes, cystic fibrosis is a chronic illness. It used to be life-threatening. It is a genetic disease that affects my lungs, pancreas, liver, reproductive system, and it's a multi-organ system breakdown disease. And the salt chlorides in my body they don't work right, and so the thick mucus builds up in my body and blocks my lungs and blocks me from breathing. And I was getting constant lung infections and constant exacerbations of my lung where I would need IV antibiotics for long-term time. I have to do breathing treatments to clear that mucus, and then also at one point when my health started to spiral, I was on oxygen as well.
Wow. And you say before, life-saving drugs and things like that, this is a life-ending illness, but that sounds not so true now.
Well, yeah, it's, Trikafta came into the picture in 2020.
Which you're holding.
Right here.
I see right there.
Yes,
yep,
right
there
here.
it is. Yep.
And you take 2 pills in the morning and 1 pill at night with food, and it actually helps correct the genetic mutation that makes up the problem in my body. So it's the first drug that treats the genetic mutation that causes CF versus just the symptoms. So it's 90% of CF patients can benefit from it. That does not mean that we all take it, because some have other side effects and other issues that they can't take. But the 10% of our population is still waiting for their miracle medication.
Yeah.
But it has made a significant change the trajectory of a lot of our lives.
Wow.
Amanda, unfortunately, we know life-saving drugs like Trikafta tend to cost a lot of money. Would you mind sharing what the cost of this medication is?
Sure. So the retail price is $326,000.
So what, $326,000
For what? For how
Retail.
much?
for like a month?
For a year.
For a year.
Yeah.
Still.
That's still a decent house in Denver.
Oh yeah. I mean, it's but it's not what I pay. So I actually pay, believe it or not, $0 because my insurance covers it 100%.
That's wonderful.
And a lot of patients don't actually pay that. They pay around $50, some a little more, most less, because of copay assistant programs and other things that I'm sure y'all will ask me about. But it's more so, but yeah, I mean, we can't hide the fact that it's super high. It was a sticker shock for all of us. We were scared that we were going to have access issues when it first came out, but we haven't.
Now, the Prescription Drug Affordability Board reviewed that medication
Yes.
and considered setting a price ceiling, but that seems good, right? But is there
Right.
an unintended consequence that we're just not
Yeah,
understanding?
it does seem good. And in fact, when I first heard about it, I heard about it from my pharmacy. I did not hear about it from the Prescription Affordability Board,
Yeah.
which is disappointing because the patient outreach was just not good, unfortunately. I wish they would have reached out to our doctors and our care staff so they could have let us know. So we could have had a little bit of preparation instead of being just thrown into something that was highly stressful. So at first I was like, well, this is great, just like I think most patients were. And so when we logged into the first meeting, we were so confused because they kept telling us, we are going to lower your prescription drug prices.
Okay.
We are going to help you guys. We are here for you. And all of us are like, but we don't pay very much. So we're confused. Are you lowering prices for us, or is this more of a state budget deal for Medicaid or Medicare patients? And so it took a lot of just trying to figure that out and why. But the most concerning thing was when I did talk to my pharmacist and I said, okay, is this a good thing? Right? He said, well, it can be, but the unintentional consequence is that if the manufacturer of my drug did not want to come down to the price cap that the state makes, they could just pull out of the state. And I'm like, they can do that? And they could. They could, because of the fact that there's a Medicaid best price guideline that really states that if any price that happens in one state trickles down to the rest of the states.
That's very scary. And for our listeners and viewers, Amanda was very close to death at one point. And this drug literally saved her life. So when she heard that this drug may leave our state, I mean, that's literally life or death. What do you think should have been done instead? Before you're hearing this from your pharmacist, you're getting bits and pieces from the board, what should have happened instead, Amanda?
I wish they would have reached out to our physicians. I wish they would have reached out to patient groups. There's lots of nonprofit patient groups, There's the Cystic Fibrosis Foundation, there's the local chapter here, I wish that we had been told ahead of time what was going to happen and how to make our voices heard. It was not very clear. You have to click on a website and then it takes you to another site and then it takes you to a sign up and a public comment and survey, and you have to be present. And even though it's Zoom, like a lot of us are still sick. This is not a cure. Our quality of life has very much improved, but I still do breathing treatments, and it was tiring, and it was just hearing that they wanted to risk our lives to do this was like, I couldn't hear. It was almost like the sound just went off in my head, and I was just like, excuse me, please help me understand this. And so, I just wish that they had done better on patient outreach. I wish that in 2021, when this bill was brought in the Senate and the House, or however it was, I'm not sure if it was even voted on, to be honest, because it's a governor appointed board. So we didn't get to vote on these board members. So I wish that they had reached out to patient groups then and our physicians then, so that when they were lobbying for this bill at the Capitol, we could have gotten some of these protections added in at that time, so that they were not like racing after the fact to try to get these protections put in. Because I agree, prescription drug prices are, they are out of hand.
is what the state doing overall a benefit for you? Do you see this as a positive thing that the state is trying to do, or are there more
Are you
concerns?
talking about like as in like lowering prescription drug
Yeah,
prices
in
or
general-
just or PDAB?
No, generally saying we're going to take a look at this and try to find a way to make this work for Coloradans, or is there more harm than good, I guess is what I'm trying to ask.
I think at this point, last year when we were pleading, we got a halt letter from 20 senators, actually legislators. I believe there were some House reps. The reason they said halt is because this is an unverified system. So I guess my answer would be until we can get some protections, until we can get some patient advocates, until we can get maybe someone who's a patient on the board, I would say no. I'm sorry to say that, but I would say until they look at other factors and add maybe some protections for us while they're negotiating the price with our manufacturer, I would say, yeah, I support that. But it's like, it's not a yes or no, it's gray.
Yeah.
When I first called you, Amanda, to see if you wanted to join us on Real Talk, we talked about intent and impact, and I thought it was wonderful how you agreed that you saw the intent.
Sure.
But you're so real about part and a very important part of that impact. So Amanda Boon, thank you so much for joining us for this Real Talk.
Thank you, I appreciate it.
Coming up, a new Colorado law is meant to help people afford one life-saving drug, but it suffered a rocky rollout.
A look at why some pharmacies are not complying with the state's new EpiPen price cap.
This is Real Talk with Denver7 and CPR News. Welcome back to Real Talk with Denver7 and CPR News. I'm Denver7's Micah Smith.
And I'm Colorado Public Radio's Nathan Heffel. Now we're taking a look at the efforts to cut costs for more than 500,000 Coloradans living with serious food allergies. But those who use medications like EpiPen say they're still paying a high price.
That's right. On January 1st, a new law was enacted designed to significantly reduce the costs. But an exclusive Denver7 Investigates hidden camera investigation uncovered a rocky rollout in the implementation of the state's new law. Questions about government breakdowns and problems in properly informing pharmacies around the state.
Now, Denver7 Chief Investigative Reporter Tony Kovaleski unravels the cost-cutting confusion.
Us as pharmacists and us as a company don't know what to do because
You are hearing the voice of uncertainty.
I honestly think most places just didn't know how to handle it.
Wow, that sounds really frustrating.
oh heck yeah.
Should this video be a wake-up call to the pharmacy board?
Absolutely. I think it should be a wake-up call to everybody that is involved with this process.
State Senator Dylan Roberts reacting to what our hidden cameras uncovered.
I think your videos show a clear confusion.
Video showing local pharmacies confused about this law, co-sponsored by Senator Roberts and signed by the governor last June. A law with bipartisan support designed to significantly reduce the cost of epinephrine injectors for tens of thousands of Colorado families. Were your expectations that pharmacies followed this law?
Yes, absolutely. I think that's my expectation. That was the governor's expectation.
Specifically, the new law acknowledges rising costs of epinephrine autoinjectors make this life-saving medication difficult or impossible to obtain for many people. It says the intent of state lawmakers is to establish an affordability program to ensure Colorado residents have greater access to epinephrine. Here's why. A set of 2 EpiPens can cost up to $700 for the uninsured in our state. The new law intended to drop that cost to just $60 by simply filling out this form. So 2 months after that law took effect, using hidden cameras, Denver7 Investigates visited several pharmacies in the metro area to see if they are following the law.
You're my first person to do this.
First person?
Yeah, so I don't know what I'm doing yet.
And he was not alone. 8 months after the governor signed the law, and 8 weeks after pharmacies were supposed to sell EpiPens for just $60, our test found the law clearly not working.
Have you heard of it?
No, I have not. It's like we don't know how we would process it on our side to make it be that price.
We heard confusion and frustration from both employees behind the counter and pharmacists.
It's a good thing that they're trying to reduce the price of EpiPens because paying $300 for one is ridiculous, but there's
Like they passed that, but there's nothing to actually take that price down.
The Board of Pharmacy just released a thing. Right now, they don't have an answer. So right now, we're all waiting to see what the manufacturers do.
Reaction to what you heard there.
Yeah, now I'm seeing a lot of different reasons why this is not working.
It says to just fill this out and bring it here, and it seems like it's like on the pharmacies to just like override the price, but we can't. Like we're not getting any type of payment, reimbursement, nothing from the government. There's no direction as to what we're supposed to do other than try to get in contact with the manufacturer.
She's a manager. What's your take?
Well, she's trying to do the right thing, but she clearly understands the frustration with the lack of accountability from these big pharma companies and a lack of information of how she can fix the problem.
You passed the law. Whose job was it to make sure these pharmacists know what's going on?
You know, the state government oversees pharmacies and pharmacists. I've run this program through the Board of Pharmacy and the Division of Insurance.
There's no doubt our hidden cameras uncovered a landscape of pharmacies confused by the new law, but it should also be noted we found a few that were able to navigate the changes.
Yeah, $60. Like it was like more than $300 before, but it brought it down to $60.
This Safeway in Arapahoe County and this King Soopers in Denver understood the law change. Now they're selling 2 EpiPens for $60.
$60 is your total.
We just need to make a few phone calls, but it's not like really complicated.
Is that every Safeway? Okay. How come other people can't do that?
I don't know. Maybe they are not trained well.
So we found a place that gets it.
Gives me some hope. I mean, it's a bright spot in a pretty tough set of videos here.
In the end, our test discovered nearly 70% of the locations we visited confused by the new law and lacking the knowledge or ability to sell us a pair of EpiPens for that discounted price.
I need to figure this out, because like I said, more people are gonna come with the same issue.
A learning moment?
A learning moment for sure. We can fix it. I'm sad about the 2.5 months that we've lost already.
We passed it this year.
Has that hidden camera video given you ammunition to fix this?
Absolutely. Now when these lobbyists come and say, it's not our fault, I can point at the video and say, yes, it is. Look at this. This is what's happening in pharmacies across our state. You, as a manufacturer, need to comply with the law and help this pharmacist do their job.
I really appreciate it. Thank you very much. Have a good day.
So the question now is what went wrong? Senator Roberts and other lawmakers have been researching and reaching out to the state's pharmacy board and the Division of Insurance. We've also learned new, stricter legislation is now making its way through the Capitol. Our journey to accountability won't end here. I'm Chief Investigative Reporter Tony Kovaleski.
And that's this week's episode of Real Talk with Denver7 and CPR News. Every week, we'll be having a real talk on issues that impact Coloradans who are often overlooked.
You can find all of our shows on denver7.com/realtalk or at cpr.org/realtalk. Have a great day.